Sayın Bakan Yardımcım, Sayın Büyükelçim, çok değerli protokol, çok kıymetli konuklarımız, hanımefendiler, beyefendiler. Türkiye Birleşik Krallık Sağlık İş Forumu'na hepiniz tüm hoşluğunuzla ve güzelliğinizle hoş geldiniz, sefalar getirdiniz. Bugün gün boyunca yapılacak olan oturumlarda birbirinden değerli fikirler karşılık bulacak ve ortak akılla hareket edilen ve ortak bir paydada buluşulması gereken konularda da hep birlikte sağlık paydasında buluşulacak. Çok değerli bilgi alışverişleri sonrasında. Şimdi öncelikle konuşmalara geçiyoruz. Konuşmasını yapmak üzere Türkiye Cumhuriyeti Sağlık Bakan Yardımcısı Sayın Doktor Tolga Tolunay'ı huzurlarınıza davet ediyorum.
Sayın Büyükelçim, İş Forumu'na Birleşik Krallık ve ülkemizden katılım sağlayan değerli sektör temsilcileri, saygıdeğer katılımcılar ve kıymetli basın mensupları. Türkiye Cumhuriyeti Sağlık Bakanlığı ile Birleşik Krallık Ankara Büyükelçiliği'nde organize edilen Türkiye Birleşik Krallık Sağlık İş Forumu'na hepiniz hoş geldiniz. Değerli katılımcılar, 2020 yılının ilk günlerinden başlayarak tüm dünyayı etkisi altına alan COVID-19 pandemisinden en az etkilenen ülkelerden birisiyiz. Cumhurbaşkanımız Sayın Recep Tayyip Erdoğan'ın liderliği, güçlü ve sağlık altyapımız ve özverili sağlık personelimizin bu süreçteki en önemli güçlerimiz olduğunu bir kez daha belirtmek isterim. Pandemiyle mücadelenin hiçbir döneminde başta ventilatör olmak üzere hastane, yoğun bakım yatağı, tanı kiti, kişisel koruyucu ekipman, tıbbi cihaz ve aşı sıkıntısı yaşamadık. Devletimizin tüm birimlerinin büyük bir ahenk içerisinde yürüttüğü takım çalışmasında kamu ve özel sektör sağlık temsilcileri büyük bir başarı hikayesine birlikte imza attılar. Bu hikaye şu an halen devam etmektedir. Yerli ve milli imkanlarımız ile ventilatör, tanı kiti, ilaç, maske, tulum gibi koruyucu ekipmanlar şu an ülkemizde üretilmekte ve sürecin başından beri de bunlar üretilmeye başlanmış durumdadır. Yerli aşımız Turk içinde geçtiğimiz hafta içinde acil kullanım onayı almak için bir başvurumuz oldu ve bunu da sizlerle paylaşmak istedim. Cumhurbaşkanımız Sayın Recep Tayyip Erdoğan da ifade ettiği gibi yerli aşımız Turk sadece ülkemiz vatandaşlarına değil tüm insanların kullanımına açılacaktır. Değerli misafirler, bu pandemi ülke sağlık sistemleri için önemli bir sınama olmuştur. Diğer yandan da insanlığın karşı karşıya kaldığı salgın ve doğal afet gibi durumlar dayanışma içerisinde hareket etmenin önemini bir kez daha ortaya koymaktadır. Özellikle tedarik konusunda yaşanan sıkıntılar pandemiyle mücadeleyi doğrudan etkilemiştir. Türkiye Cumhuriyeti olarak tedarik konusunda hiçbir sıkıntı yaşamadık. Bu süreçte ülkemizdeki ihtiyaçları karşıladığımız gibi başta kardeşlerimiz olmak üzere diğer ülkelerin ve uluslararası kuruluşların pandemiyle mücadelesine de ciddi destek verdik. Ve bu desteklerimiz de şu an için devam etmektedir. Şu anda tüm dünyada olduğu gibi aşılama çalışmalarına yoğunlaşmış durumdayız. Birinci, ikinci ve üçüncü doz olarak toplamda 120 milyon dozun üzerinde aşılama yapmış durumdayız. Değerli misafirler, Türkiye'nin sağlık alanında var olan potansiyeli pandemi döneminde bir kez daha kendisini göstermiştir. Türkiye Birleşik Krallık Sağlık İş Forumu'nu düzenleme amacımız karşılıklı olarak kazan-kazan anlayışı çerçevesinde her iki müttefik ülkenin mevcut sağlık pazar payı potansiyelini daha ileriye götürmek ve yeni işbirliklerine zemin hazırlamaktır. Bakanlığımız bağlı özel şirket statüsünde olan Uluslararası Sağlık Hizmetleri Anonim Şirketi kısa adıyla USAŞ, pandemi sürecinde hem ülke içindeki ihtiyaçlarımızın karşılanmasında hem de diğer ülkelere sağladığı destek ve kolaylık ile hayati bir rol oynamıştır bu süreçte. Ülkemiz kamu ve özel sağlık tesislerinde verilen kaliteli ve uygun maliyetli sağlık hizmet sunumu birçok ülke tarafından dikkatle izlenmekte ve ülkemizde ağırladığımız uluslararası hasta sayısı da günden güne artmaktadır. Uluslararası hasta tedavisi ile birlikte sağlık yatırımları ve hizmet alımları ile ilaç, tıbbi cihaz ve malzeme alanlarında da ülkemiz sizler için önemli bir ticari partner olduğunu ve bu alanda ortak işbirliğimizi arttıracak faaliyetlere hazır olduğumuzu ifade etmek isterim. Değinmek istediğim diğer bir önemli konu ise sağlık bilgi sistemleri. Sağlık bilişimi ve sağlık dijitalleşmesi adına geldiğimiz noktada dünyaya örnek teşkil edecek tüm hizmet süreçlerimizi birbirine entegre ettiğimiz ve hem vatandaşımızın hem de sağlık personelimizin hizmetine sunduğumuz çok sayıda projeyi başarılı bir şekilde yürütmekteyiz. Yine Kasım ayı içerisinde Antalya'da 7.sini düzenlediğimiz HIMSS Kongresi bu kongreyle bu alandaki öncülüğümüzü perçinledik. Dijital hastane açısından HIMSS mükemmelliyet seviyesi seviye 7 sayısına sahip hastane sayımız 5'tir. Bu sayı Avrupa'nın tamamında 5 ve ülkemizde de dediğimiz gibi sadece Türkiye olarak biz HIMSS 7 noktasında 5 tane hastanemizi bu noktaya çıkartmış durumdayız. Bunun yanı sıra validasyonu tamamlayarak seviye 6 konumuna gelen hastane sayımız da 62. Ağız ve diş sağlığı merkezlerimizden ikisi de seviye 7 noktasına gelmiş olup 14 tane de ağız diş sağlığı merkezimiz seviye 6 düzeyindedir. Değerli katılımcılar, Türkiye, Birleşik Krallık İş Forumu'nun gerçekleştirilmesinde Türkiye Cumhuriyeti Sağlık Bakanlığı ile Birleşik Krallık Ankara Büyükelçiliği yetkilileri başta olmak üzere emeği geçen herkese teşekkürlerimi iletmek istiyorum. Umuyor ve inanıyorum ki bu etkinlik her iki taraf için de yeni fırsatların oluşmasına katkı sağlayacaktır. Devamlılığını son derece önemli bulduğum bu iş forumunun ikincisinde İngiltere'de yapılması hususunda değerlendirmenize sunuyorum. Sağlık Bakanlığı olarak sağlık alanında her türlü işbirliğine hazır olduğumuzu, bu ve benzeri etkinlikleri her zaman destekleyeceğimizi bir kez daha ifade ediyor. Katılımlarınız için sizlere teşekkür ediyorum.
Çok teşekkür ediyoruz Sayın Tolunay'a. Şimdi de kıymetli konuklarımız konuşmalarını yapmak üzere Birleşik Krallık Türkiye Büyükelçisi Sir Dominic Chilcott'u huzurlarınıza davet ediyorum.
Well, good morning, everybody, and good morning, Deputy Minister, and ladies and gentlemen. May I add my warm welcome to all the participants at the first ever UK-Turkey Healthcare Business Forum. It's a great pleasure to speak at the opening of this inaugural conference, a conference that reflects Britain's and Turkey's ambition to deepen our links in the healthcare sector. Britain and Turkey first signed an agreement on healthcare business collaboration in 2019 during the visit of the then Prime Minister's trade envoy to Turkey, Lord Janvrin. Now, that agreement provided a framework for strengthening innovation and trade and investment between our two countries in healthcare. And I'm very grateful, as we all are on the British side, to the Minister for Health in Turkey, Dr. Fahrettin Koca, and his deputy ministers and officials for their support to this project. We see a lot of potential to grow trade, investment, and science links between the UK and Turkey in a wide range of activities in the healthcare sector. Our aim of strengthening UK-Turkey healthcare business collaboration is an important aspect of our aspiration to grow the broader relationship between our two countries, at the political level, at the business level, and at the people-to-people level. The British-Turkish relationship has always been important, but perhaps now that the United Kingdom has left the European Union, these relations between us, between two G20 economies, between two NATO allies, between two founder members of the Council of Europe, perhaps these relations are even more precious than before. And one of the most important areas to which we should give and are giving the highest priority must be the reinforcing of our commercial links, which underpin so much else that we do. Now, we start from a strong position. The UK is Turkey's second largest export market, and before the restrictions due to the COVID pandemic, our trade had grown 50% in the previous 10 years and had comfortably passed the target of $20 billion set in 2017 by His Excellency President Erdogan and the then British Prime Minister Theresa May. In fact, according to our figures, we had reached a pre-pandemic high of over $24 billion. Last December, just before the United Kingdom left the EU customs union, we signed a new bilateral free trade agreement with Turkey. That agreement will safeguard our existing trade, which has, as I've said, grown to significant levels, facilitated by the customs union arrangements. The next step is to build on that strong foundation in the future by negotiating a new, comprehensive free trade agreement, and we are committed to starting work on this before the end of next year. The contribution to our two-way trade and investment made by the medical healthcare sector is already significant. Healthcare companies constitute the fourth largest group in the UK's exports to Turkey. And as well as providing jobs and incomes to workers and profits to the companies concerned, this sector, of course, delivers real benefits to our peoples as a whole. So this forum, where we've come together to increase our collaboration in the healthcare sector, is of far-reaching importance. The UK and Turkey share a number of significant challenges and opportunities in the healthcare sector. Life expectancy has been increasing in both our countries, and with that comes a larger burden of chronic, non-communicable diseases. We have a high prevalence of cardiovascular disease, of cancer, diabetes, and obesity to tackle. We face new infections and viruses, as demonstrated by the COVID-19 pandemic, and at the same time, we are living in an increasingly digital, connected world, and healthcare services, like other parts of the economy, must keep pace with that. It's my hope that by boosting collaboration between the UK and Turkey, we can help each other to tackle these challenges. So one of my messages to our Turkish friends today at this forum is that the United Kingdom, with its well-established universal health system and vibrant technology and science environment, stands ready to work with you. I believe there's a lot we can learn from each other. In the UK, we're lucky. We're very emotionally attached to our health system, which is world-class. Since the inception of the National Health Service, the UK's National Health Service, in 1948, we've had a comprehensive, free at the point of delivery service based on clinical need and not on the ability to pay. The NHS, as we call it, has developed into the world's largest integrated care system. Over the past 72 years of its existence, we have developed expertise in planning and managing efficient, equitable, and high-quality healthcare. Over the course of that time, the NHS has delivered this high-quality and cost-effective healthcare through a system in which every part works to improve outcomes for patients and which has inspired and influenced governments and organizations around the world. It has expertise in strategy and planning, funding, training, innovation, service delivery and regulation, all of which work together to support a complete and integrated service. And we have clear strategies as well to improve prevention, diagnosis, treatment, and care until the end of life. Now, the UK works with partners all over the world to improve and enhance healthcare systems and to exchange ideas and research. To give a few examples, the Royal Free Hospital in London is training nurses in Japan. The NHS in Northumbria is advising on the design, build, and operation of medical cities in China. And Guy's and Thomas's NHS Trust have supported the development of a severe respiratory failure service with ECMO capability in Qatar, following the outbreak of Middle East respiratory syndrome. But the National Health Service, the NHS, is not the whole picture. It's one part, albeit the biggest part, of a vibrant ecosystem which also includes cutting-edge healthcare businesses and pioneering academic institutions that are making an impact on how healthcare is designed and delivered globally. Decades of collaboration between the NHS, academic and private sector organisations have created a large number of innovative providers who are continually developing and adapting new healthcare solutions. We're also a pioneer in fostering innovation in healthcare and are home to a number of programs to encourage its adoption and spread, such as the NHS Innovation Accelerator, which produces leading-edge products and services. Partnering with the UK, healthcare and life sciences sectors will enable Turkish patients to benefit from innovative, research-driven and evidence-based technology in areas such as mobile health, remote care, and artificial intelligence. Digital and technology are key enablers of healthcare and have been transformative in helping us in the UK meet our modern health challenges. We're home to many exciting companies, large and small, who are developing and delivering innovative products and services to support high-quality care and improve the health of our population, and many are with us today in this forum. The UK develops some of the world's most sophisticated digital systems for diagnosing, delivering and monitoring high-quality, patient-centred services. We're at the forefront of transforming health services by using digital solutions to prevent and manage chronic illnesses more effectively. The UK is also at the forefront of science and research in life sciences and has long been an innovator, from the world's first medicinal patent in 1698 for Epsom salts through to the discovery of the structure of DNA in the 1950s, to MRI, medical ultrasound, the glucose biosensor, IVF, open heart surgery. These have all been British innovations. The UK's leading science base offers industry access to world-class talent, infrastructure and data, and we have a strong tradition of international scientific collaboration. The NHS was the first national healthcare system to introduce genomics into mainstream medicine, creating the world's first national genomic medicine service. So, what opportunities does collaboration between the UK and Turkey present? Well, speaking for the UK, Turkey is a large and fascinating market and one where we see lots of potential. We already have strong commercial ties, and some of our biggest companies are active here. UK pharmaceutical and vaccine business GSK, GlaxoSmithKline, has been invested in Turkey for over 60 years, and biotechnology and pharma company AstraZeneca have been here since 1999. In the last 3 years, we've had new investor arrivals from the UK, including healthcare insurance company Bupa, and British nutraceutical company Vita Biotics, which shows real confidence in the potential of Turkish healthcare. If we're to continue to grow the scale of UK investment into the Turkish healthcare sector and ensure that Turkish patients benefit from the most innovative medicines and technologies, we will need to collaborate closely on building a competitive investment climate that is favourable to stimulating further investment. By supporting the implementation of transparent, inclusive, predictable and efficient policies and regulatory practices, we will unlock the potential of UK-Turkey investments in this sector. I hope that our panels and roundtables today will allow us to discuss ideas to further improve the environment for investment and business. I would like to repeat that there is a real appetite to grow existing links and build new ventures, as demonstrated by the very large interest from the British healthcare business community who have flown to Istanbul for today's forum despite the challenges of international travel during the pandemic. We have a British government, British business and academic delegation today of over 120 representatives, which includes almost 50 different British companies. We hope momentum will continue to grow from today's event into future iterations of this healthcare forum. For myself, I'm looking forward greatly to learning more about Turkey's excellent and fast-growing healthcare sector, and the Deputy Minister's speech this morning has already given us lots of interesting information about that. Turkey's large-scale hospital build programme is but one area that demonstrates the ability of Turkey to procure and deliver large and complex healthcare facilities in record time. In digital health, Turkey has a number of novel innovations, such as the e-Nabız system, which enables the exchange of data among all levels of the healthcare system and improves the patient's experiences across this ecosystem. The Deputy Minister referred to Turkovac in his speech, which we look forward to becoming a key component not only of Turkey's vaccination programme, but that of many other countries around the world. And in passing, I should say that I'd like to once again reflect upon the generous support of the Turkish Ministry of Health to the UK in the early weeks and months of the pandemic with the gift of PPE that was much needed at the time by the UK's national health system. We remain very grateful for that great gesture of generosity. So, in summary, there are many reasons to admire what Turkey has achieved in the healthcare sector in recent years, and with the strong political will from our two governments and the great interest shown by our business communities, as we see from the impressive attendance at today's forum, today's event has the potential, I believe, to be the start of something really important and significant. So thank you very much, and I hope everybody has a successful forum.
Çok teşekkür ediyoruz. Şimdi kısa bir filmimiz var. Onu izleyelim dilerseniz.
We have come a long way. As the components of the Health Transformation Program, the presence of a planning and supervising Ministry of Health, solutions offered by universal health coverage, which brings all our people under a single roof. The friendly provision of healthcare. Strengthened primary healthcare and family physicians. And with our improved health informatics infrastructure, we set sail for new corporations. We are holding the first health business forum after the pandemic with the United Kingdom. In the Health Business Forum, organized by Açılış under the leadership of Health Minister Dr. Fahrettin, representatives of the Turkish health sector and UK government officials are coming together. Turkey, which is among the top 10 countries in most preferred global health services, is now aiming higher. Thank you for joining us in our steps towards leaving a great health legacy to future generations.
Evet. Şimdi sunumlar var kıymetli konuklar. Birleşik Krallık için Türkiye sağlık sektöründeki fırsatlar başlığını taşıyor. Hemen davet edeyim. Sağlık alanında Türkiye'nin uluslararası tanıtımından sorumlu kurumu olan ve Türkiye Birleşik Krallık Sağlık İş Forumumuzun da organizasyon sorumlusu, USAŞ'ın Yönetim Kurulu Başkan Vekili ve Genel Müdürü Sayın Mehmet Ali Kılıçkaya'yı huzurlarınıza davet ediyor.
Honorable Deputy Minister, His Excellency Ambassador, esteemed UK and Turkish officials, and representatives of the participating companies, distinguished guests, members of the press, ladies and gentlemen. I am honored to welcome you to all to the UK-Turkish Health Business Forum. In my presentation today, under the four following headings, firstly, I will talk about the commercial relations between UK and Turkey. Secondly, I will explain Turkey's health system in general, the success story it has revealed in the last period, and the positions of the Turkey in terms of health tourism. Later, as USAŞ, I will give information about my institution, its general duties, future vision, and activities. Finally, I will conclude my speech by mentioning the possibilities of the cooperation areas. The political, economic, and commercial relations between Turkey and UK, the two big countries, one in the east and the other in the west of the continental Europe, have an influential historical background. UK has been one of the most important trade partners of the Turkey for years. The FTA signed between our countries, which became closer and whose friendly relations gained momentum in the post-Brexit period, is the first bilateral free trade agreement of the UK after Brexit, and has been a step that will further strengthen the commercial relations. When we look at the trade statistics and the figures, UK is the second largest market in our country's export in 2020. In the same year, UK became the 11th biggest supplier of the Turkey, and in 2020, Turkey's export to UK was recorded as $11.2 billion, and import from the UK was $5.6 billion. In total, the trade volume reached $16.8 billion, and Turkey has trade surplus of $5.6 billion. In this trade volume, while Turkey has a deficit in the pharmaceutical and medical devices sector, it has surplus in the medical consumable sectors. When we think about the services sector, especially the health tourism, health tourists from the UK visit our country for treatment in many branches, especially plastic surgery, dental health, or ophthalmology. And therefore, Turkey has surplus in this specific sector, which reflects the health sectors of the two countries are complementary rather than competing. This is very important, and which increases the cooperation opportunities and offers significant commercial potential. After giving the information about the trade figures, I would like to focus on the Turkish health system. Turkey achieved great success story with the reforms that started with the Health Transformation Program. Under this program, 99% of the population is covered by the general health insurance. Hospitals operating under different institutions were combined under one roof. General health insurance has become available in university hospitals, private hospitals, and public hospitals. Patient satisfaction doubled and reached to 72%. This is actually a success story. And significant improvements were achieved in health indicators. Health expenditures are no longer a burden for the citizens. When we look at the indicators, as you know, according to WHO, the most important indicator for the development of a country is life expectancy at birth. As you can see in the screen, in 2020, compared to 2002, the life expectancy at birth in Turkey has risen from 72.5 years to 78.6 years. This is a success story. We have performed well in other indicators as well. For example, the infant mortality rate and the maternal mortality ratio has decreased drastically. Compared to 2002, in 2020, infant mortality rate per 1,000 births has decreased from 31.5 to 6.4. The maternal mortality ratio per 100,000 births has decreased from 64 to 13.1. Regarding the international comparison, in terms of the life expectancy at birth, as you can see, Turkey has a better performance than WHO European region, upper middle income countries, and global average. Concerning the infant mortality rate, again, Turkey is better than the upper middle income countries and global average, and its performance is close to WHO European region. In terms of maternal mortality ratio, Turkey's performance is better than upper middle income countries and the global average, and very close to WHO European region. After giving brief information about the indicators and health transformation program of the Turkey, I would like to give some details on the capacity of Turkish health system. As you can see in the screen, looking at the numbers and the distributions of the hospitals, there are 944 public hospitals with a share of 58%. There are 563 private hospitals with a share of 37%. And there are 68 university hospitals with a share of 5%. As of 2020, we have 1,272,000 healthcare professionals. About 95,000 of them are specialists, 91,000 are general practitioners, and 35,000 of them are dentists. Latest investment in the Turkish health system are the integrated health campuses, which are being established with the aim of improving service quality and settling health service balance in a cost-effective way. At the moment, there are 14 operating integrated health campuses and 5 signed projects that are in progress. Overall, these health campuses have a capacity of 44,750 skilled beds. And now, I would like to share a short video of the health campuses located in Istanbul and Ankara. Voice. Thank you for your attention. To share the international reflection of the healthcare transformation program to Turkey and its performance, I would like to refer some of the WHO publications. In one of the publications saying that healthcare services have become accessible to entire population, the confidence of the population in the use of public services has improved. Another WHO publication showed Turkey as a case study of successful health systems and saying that Turkey has done what few other countries have managed to do, to dramatically improve health and health system outcomes in a very limited amount of time. Moreover, this issue was in the OECD health system reviews as follows. The health transformation program represents both an important improvement in Turkey's social welfare system and a good practice example for other countries struggling with the same issues. Turkey, one of the world's leading countries in health tourism. According to some sources, it is among the top 5 most successful countries in the world. The list of the factors behind the success of the Turkey as follows: the modern medical technology, qualified personnel, high-quality services, short waiting periods, and affordable medical fees. Actually, these are the results of the Turkish health transformation program and public and private hospitals investments. And this success also because of the close flight distance of the Turkey and its geographic location and socio-cultural similarities with the surrounding countries and touristic facilities. The number of the health tourists reached about 660,000 in 2019, and the revenues exceed $1 billion. As you can see, there is a rising trend. But in 2020, because of the pandemic, both the number of the health tourists and the revenues decreased by half. But when we came to 2021, in the first quarters of this year, compared with the previous year, the number of the health tourists increased almost 70%, and the revenues increased 50%. These figures show that we will reach the pre-pandemic figures of the 2019 by the end of this year. And hopefully, the upcoming years, the increasing trend will continue to foster. Health tourists from many different countries and regions coming to Turkey for different branches depending on their varying needs. As you can see on the screen, the countries from which the health tourists are traveling from are geographically close to Turkey. In this context, while branches such as aesthetic surgery, dental hair, ophthalmology, or bariatric surgery are preferred mostly from the countries which have developed health system, such as UK or Europe. On the other hand, health tourists traveling from the countries with poorer health system prefer more vital branches, such as organ transplantation, oncology, or cardiology. In Turkey, both health institutions and intermediary companies must obtain a certificate of authorization from the Minister of Health to engage in health tourism activities. Currently, there are 1,406 health institutions and 285 intermediary companies active in Turkey, which meet the criteria such as the quality score above a certain level, employing foreign language speaking personnel, having foreign language websites and call center, etc. Moreover, 46 of these institutions have GCI accreditation and 7 of them have the TÜSKA certificate, which provides accreditation according to ISKOA rules. Although there is a countrywide distribution, we can still observe that the authorized institutions are mainly located in Istanbul and its surrounding provinces. And now I would like to talk about USAŞ. USAŞ, International Health Services Incorporation, established by law at the beginning of 2019. USAŞ is an affiliated organization of the Ministry of Health and has branches in Ankara and Istanbul. According to law, the most important duties of the USAŞ are to promote the Turkey's health system in international area, to carry out intermediary activities on the behalf of both public and private hospitals, to take initiatives for the resolutions of the complaints and the disputes, and to take preventive measures, to carry out the activities in the healthcare education, to provide consultancy on PPP models, health system and financing, and to share the Turkey's experiences in coordination with Ministry of Health, to open and operate health institutions abroad, and to supply medicine, medical devices, and consumables. Based on these duties, we set certain strategic objectives as the following: carrying out strategic promotional and marketing activities of the Turkish health system abroad under an umbrella brand, opening health tourism coordination offices, diagnosis centers, and hospitals in target countries, making agreements with foreign government institutions and the insurance companies, creating of complication insurance for health tourists, establishing an IT infrastructure for health tourists where compliance and satisfaction can be monitored, and carrying out strategic projects for localization of pharmaceuticals and medical devices. In this context, USAŞ participated in many overseas visits and activities since its establishment, and negotiated agreements with the health authorities of the countries visited, relevant NGOs, and private sector institutions. After these visits and efforts, we have signed an agreement and the cooperation protocol with the country of Kazakhstan, Djibouti, Libya, Somali, Kyrgyzstan, and Georgia. And now we are negotiating with the countries of Uzbekistan and Kuwait, and start to negotiate with certain other countries as well. USAID is also carrying out many other promotional activities of Turkey. Just as we are doing at the moment in UK Turkish Business Forum, we organized a similar event in Uzbekistan. In the next year, the business forums will continue with Pakistan and Azerbaijan. Also recently, we have organized a workshop with American Chamber of Commerce to strengthen medical tourism in Turkey and participated in HIMSS 2021. USAID will continue to participate in similar activities in the upcoming years. USAID also made a very important contribution to Turkey's fight against COVID-19 with its fast purchasing and supplying process at the beginning of the pandemic. As you remember, when the protective materials were scarce and their prices were very high. Moreover, USAID became the financer of Biovent ICU ventilator, which is the Turkey's first domestic and national medical device, and played a very important role in the commercializations of this device, and became the export champion in the medical device category in 2020 with its turnover mainly consisting of the sales revenues of this ventilator. The role of the USAID in the fight against the COVID-19 and its contribution to the capacity building in critical products such as protective materials, diagnostic kits, and respirators has been shown by the UNDP as a role model for less developed countries. Within the scope of the signed protocol, USAID started to support the transformation projects of the health systems of less developed countries in coordination with UNDP. USAID also signed a protocol with MasterCard. Within the scope of this protocol, we have started to promote the Turkish health system for the MasterCard holders in Kazakhstan, Azerbaijan, and Georgia. Similar promotional practices will be soon expanded to other countries as well. The last heading of my presentation is the cooperation opportunities. There are opportunities to develop cooperation and mutual trade between Turkey and UK in many areas within the field of health, particularly joint investment and projects in health tourism, pharmaceuticals and medical devices, information technologies, education, and PPP. I think there are also joint investment opportunities in third countries as well. On the occasion of this event, we, as USAID, are proud to contribute to new cooperation opportunities between our countries, sectors, and companies. This is the end of my presentation. Thank you very much for listening to me. Thank you.
Teşekkür ediyoruz Sayın Kılıçkaya'ya. Şimdi de Cumhurbaşkanlığı Yatırım Ofisi Koordinatörü Sayın Derun Ülgen'i huzurlarınıza davet ediyorum.
Honorable Minister, His Excellency the Ambassador, distinguished guests, ladies and gentlemen, welcome. My name is Derun Ülgen, and I'm representing the Investment Office of the Presidency of the Republic of Turkey. It's a great honor for me to be here today, and I would like to thank the organizers of this event for giving us this opportunity. Dear guests, in my presentation, does it work? Oh, okay, sorry. In my presentation, I will provide you with some detailed information about the Turkish life sciences industry and highlight the opportunities it's providing to the global investors. Actually, Turkey has a growing pharma industry and becoming a hub for medical technologies, offering opportunities in different areas. Turkish pharmaceutical industry is one of the most dynamic and strategic sectors of the country, with its long production experience, qualified workforce, and high added value structure founded on the leading edge technology. Now let's have a detailed look at the industry. It works slowly, sorry. In 2020, Turkey has accounted about 1.5% of the global pharmaceutical market and ranked 18th with $7 billion in value. The pharmaceutical market has experienced more than threefold, so sorry, it works. Oops. Sorry. Oh, here. Turkish pharmaceutical market has experienced more than threefold growth since 2010 and has reached 48 billion Turkish liras in 2020, with an increase of 17.6%. 6%. Originator drugs dominate the market with 66% in share in value and 43% share in units. The size of the originators has reached 32.7% in 2020. When we look at the market share by therapeutical class in value, we see that all treatment groups, except for antibiotics, have had an increasing trend during the last 6 years. And oncological products have been the most sold treatment group in value with a share of 14.5%. As for the pharma exports, we see that pharma exports have more than tripled since 2010, and in 2020, our exports have reached a record-breaking $1.8 billion. We have also diversified our export markets. Nowadays, Turkey is exporting to more than 180 countries in the world, including European Union, North Africa, and Middle Eastern countries, and CIS countries. In Turkey, we will see the import. Here we are. In Turkey, in 2020, Turkish pharmaceuticals imports equaled $4.9 billion. And here we see the breakdown by countries. Actually, Turkey mostly imports originator drugs, vaccines, plasma derivatives, and biodrugs. There are 59 pharmaceutical and 11 raw material facilities in Turkey. And actually, the industry is producing more than 12,000 products with over 39,000 employees. And there are 20 multinational companies with production facilities in our country. for the medical devices market, we see that it's the second largest market in Central and Eastern Europe and first in size in comparison with Middle Eastern and North African countries. And actually, Turkish medical devices market is worth $2.5 billion in 2020. And it's expected to grow by 7.7% per year on Turkish lira basis between 2021 and 2024. And in this slide, we see the medical device sales by product area, and we see that patient aids and consumables are high growth product areas. As for the exports of medical devices, we see that China is the leading destination for Turkish medical devices with a share of about 10%. And the European Union in total accounted for over a third of exports in 2019. Again, in 2019, the United States was the leading supplier, accounting for about 17%, and the EU supplied almost 40% of imports. The leading EU suppliers being the Germany, France, Italy, Ireland, and the United Kingdom. Here we see the major medtech players benefiting from Turkey's strategic location to manufacture, export, innovate, and manage. Let's have a look at growth drivers in Turkey. Actually, Turkey is the 11th largest economy in the world with an average annual GDP growth rate of 5.1% between 2003 and 2020. Turkey has a young, dynamic, and well-educated population, with half of its population being at the age of 32. We have a skilled workforce, and here we can see the undergraduate and graduate enrollment in related fields. This slide is about the availability of qualified engineers, labor cost per hour in manufacturing, availability of competent senior managers, and their remunerations. Well, when we look at the incentives, we see that pharmaceutical and medical device investments pharmaceutical sector, medical device, and R&D activities take priority and can benefit from various lucrative incentives. The main incentive tools being tax deduction, VAT exemption, customs duty exemption, interest rate support, and land allocation. Actually, pharmaceutical and medical device investments are benefiting from strategic incentives. This is for project-based incentives. Actually, project-based incentives are granted to R&D intensive and innovative investments with high added value, which will diminish the import dependency of the country and promote the technological transformation. The minimum investment amount to be able to benefit from these incentives is 500 million Turkish liras. This is about high-tech driven industry initiative. High-tech driven industry initiative, which is a new incentive program launched by the Ministry of Industry and Technology. Actually, the minimum investment amount for this initiative is 50 million Turkish liras. Well, Turkey has created an ecosystem of R&D and entrepreneurship, as you can see here. And IPR protection. IPR protection is a key activity for the outputs of the R&D activities in the health sector as for the other sectors. And Turkey has significantly improved the IPR protection during the past decade, and in 2017, a new law has been adopted. Now let's have a brief look at the opportunities in Turkish life sciences industry. Turkey has introduced the health transformation program, as it has already been mentioned, in 2003, and the universal health insurance in 2006. And therefore, since then, the spendings have been increased, almost doubled since then. Healthcare spendings have doubled since then. Here we see the different opportunities in different areas. For example, for biopharmaceuticals, in 2020, biopharmaceutical products constituted 18% of the prescriptions, with a value of $938 million. Actually, Turkish industry has developed competency in this field and increases its share in the market. And we are targeting to launch 2 biotech drugs and 40 biosimilars by 2020. For diabetes, Turkey has over 8 million diabetes patients, and this number is the 3rd largest in Europe. Actually, Novo Nordisk and Sanofi are present in the market with 6 different brands. For vaccines, Turkey is targeting to localize 100% of the vaccines by 2024. And localization gained speed since 2009, and 3 to 7 year purchase guarantee provided for local production. In terms of the number of clinical trials carried out, Turkey ranks 26th in the world with more than 520 clinical trials in 2019. Turkey has already a significant infrastructure for clinical trials and has the potential to triple it in the medium term. The total economic value of the clinical trials carried out in Turkey as of June 2019 is estimated as $328 million. As for the opportunities in medical devices, here it is. Oops, sorry. Here we are. Well, the consumables market is expected to grow by 4% in US dollars terms between 2021 and 2026, and this growth will take the market to $646 million, making the consumables second fastest growing product area. The diagnostic imaging, actually 95% of the market is supplied by imports, of which about 50% is coming from the European Union. The orthopedics, this market is expected to reach $234 million in 2026. And medical tourism has already been explained in detail previously. And here we see the site assessment. Actually, Here we are. Here we see the pharmaceutical manufacturing clusters in Greater Istanbul region and Tekirdağ. And site assessments for several investment regions with different advantages can be done for potential investors. There are two types of special investment zones in Turkey, actually, organized industrial zones and free zones. There are 258 organized industrial zones and 19 free zones close to the EU and Middle Eastern markets. And they have their own advantages for investors. Turkey hosts many multinational medtech players for manufacturing, management, and innovation purposes, as you can see here. Well, here we see that more than 1,000 manufacturers are clustered across the country. For example, Samsun is an important center for that, and Ankara. And here are the other clusters you can see in detail. And last but not least, our office, operating directly under the presidency, the investment office responds to the needs of the investors who would like to invest in Turkey with a one-stop shop approach. While the office stays in touch with the investors from the initial contact until and even after the completion of their investment projects, providing support to the investors at every stage of the investment, such as establishment of the company, providing information about incentives, incentive applications, land procurement, and coordination of relations with other institutions and organizations. Adhering to the principle of strict confidentiality, our office is structured to solve investors' problems quickly and efficiently, and we also play an active role in the development of policies and strategies aiming to improve our country's investment and business environment. Thank you so much for your attention.
Çok teşekkür ediyoruz Sayın Ülgen'e. Şimdi kafe break var. Hemen yan salonda hem de firmalarımızda ziyaret edebilirsiniz. Sonrasında da devam edeceğiz.